Hello everybody, welcome back to my channel. This is Haytham. Today we'll be discussing the cervical plexus. The cervical plexus arises from C1, C2, C3, C4, and C5. Their ventral rami, of course. We observe from C1 a close relationship with the hypoglossal nerve that innervates muscles such as the geniohyoid, thyrohyoid. It also forms the superior root of the ansa cervicalis, which is in charge of innervating muscles such as the superior belly of the omohyoid, the sternothyroid, the sternohyoid, and inferior belly of omohyoid. The inferior root of ansa cervicalis is formed from C2 and C3. C3 and C4 give rise to supraclavicular. C3, C4, C5 give rise to phrenic. Between C1 and C2, we see a communicating branch going towards the vagus. We also see nerves innervating muscles, such as the rectus capitis anterioris, rectus capitis lateralis, and longus capitis. Between C2 and C3, first from C2 we have longus capitis, longus cali, and lesser occipital. And between C2 and C3 we give the greater auricular and transverse cervical. And finally, from C3 and C4 we have branches going to longus capitis and longus cali. And from both C3 and C4 we have levator scapular nerve and scalene nerves.